volume reveals all.
Yes.
And I love this. I actually brought this up to some friends when I was at ACOS, and I told them I don't want to dive too deep into this because I feel like this is like an hour or two long conversation in and of itself. Because I feel like the general perception is high volume means low quality. And people who are high volume surgeons are doing 5 or 6 minute cataracts. They're just rushing, they're cutting corners, they're not giving the patient their best. When it's actually the complete opposite, because if you have complications or you have bad outcomes, patients are not going to be happy. You're going to get bad reviews. You're not going to get patients coming to you for surgery. And it's just going to slow you down. Having a complication to manage that properly just adds more time to your schedule. So to be high volume, to do a lot of surgery means you have refined your craft to the highest level. And I love that you brought it up in terms of not just surgery, but every part of the patient experience. So it's not just, is there a surgical complication, but maybe they were having dysphotopsias afterwards. Maybe they were having a little pain from, an injection or something like that. And so every aspect of the process through high volume has to get refined if you really want to be delivering the best outcomes and doing it in an efficacious and efficient manner.
Totally. That's exactly right. So volume reveals all. And so I think that's a great way to look at it. I think anesthesia is one of those aspects that can be easily overlooked, but an uncomfortable patient is going to tell, one or two other patients, family members, they may not come back for their second eye. They're going to tell the referring doctor, gosh, I was there, I had some discomfort. And so if you can look at what we've done for our anesthesia protocols, we're constantly looking to try to maximize the most comfortable situation from, let's say the MKO melt, so sublingual medications combined with IV medications, combined with hand holding, combined with just the way, we lay the stretcher or whatever, the lighting in the room, all those things sort of add up to more or less making that comfortable patient experience. And anesthesia is a big portion of that. And if you're just doing a few cases, you might be able to tolerate a little bit of discomfort, but at a certain volume, you really have to make sure every single patient is as comfortable as they can be. And so it kind of constantly pushes that sort of innovation cycle. And I think that's where you see a lot of the high volume centers innovating with whatever technique. It might be innovation in a surgical technique or innovation in anesthesia or innovation with a outcome, efficacy or safety, because they see where those, potential pitfalls are, and they're always looking to kind of find what we call the pain points in the process. And so, at a certain lower volume, you just might not see the pain points, or it might not really be that meaningful, but at a certain volume, it becomes evident that the limiting factor to go to the next level is going to be that pain point, and you have to look for some solution to make that easier.